Have you ever experienced that unsettling, queasy feeling in your stomach that just won't go away or keeps returning day after day? While occasional nausea is common, a persistent sense of unease in your gut can be more than just a fleeting discomfort. When nausea becomes chronic, meaning it lasts for weeks or even months, or is severe and accompanied by other concerning symptoms, it absolutely requires medical attention. This isn't something to simply endure. It is your body sending a clear signal that something needs to be evaluated by a healthcare professional. Chronic nausea is not a diagnosis itself but rather a symptom, a signal of an underlying condition that needs to be identified. The why behind it can range from relatively benign issues to more serious health concerns. For instance, common digestive issues like gastroesophageal reflux disease, also known as GERD, gastritis, or even a peptic ulcer can cause persistent stomach upset due to inflammation or irritation of the digestive lining. Infections, such as the H. pylori bacteria or certain viruses, might also be culprits disrupting your gut balance. Sometimes, medications you are taking can have nausea as a side effect. More complex systemic conditions like diabetes or thyroid disorders can also manifest with chronic nausea. However, it is crucial to rule out serious conditions such as gallbladder disease, pancreatitis, liver problems, or even certain types of cancer, where early detection is paramount for effective treatment. Observing accompanying symptoms like unexplained weight loss, vomiting blood, severe abdominal pain, persistent fever, yellowing of the skin or eyes known as jaundice or dark tarry stools are significant red flags that warrant immediate medical evaluation. When preparing to see your doctor about chronic nausea, gathering information is your best step. Make a detailed note of when your nausea started, how often it occurs, what makes it better or worse, and any other symptoms you are experiencing. List all medications you are currently taking, including over-the-counter drugs and supplements, and mention any recent changes to your diet or travel history. This comprehensive record provides your doctor with vital clues to help pinpoint the cause. Your doctor will typically start with a thorough medical history and a physical examination. To uncover the root cause of chronic nausea, they may suggest various diagnostic tools. This could include blood tests to check for infections, inflammation, or organ function, as well as stool tests to look for digestive issues. Imaging tests, like an ultrasound or computed tomography scan, known as a CT scan, might be ordered to visualize internal organs. In some cases, an endoscopy, where a thin, flexible tube with a camera is used to examine your upper digestive tract, might be necessary to directly assess for ulcers or other abnormalities. Understanding the cause of your chronic nausea is the first and most critical step towards finding relief and preventing potential complications. By taking proactive steps and consulting with a healthcare professional, you ensure a proper diagnosis and receive the appropriate treatment tailored to your specific condition. This approach not only alleviates discomfort but also supports your overall long-term digestive health and well-being, allowing you to live without that constant, unsettling, queasy feeling.